Why do I smell Parmesan cheese? Screech, what kind of suntan lotion is this? Zesty Italian? Great. Salad dressing? What am I supposed to do now?
Well, let's hope that you're a little wiser than that. Although that is delicious.
Indeed, yeah.
Dr. Mary Jo Kerns is with us. She's a dermatologist and one of the finest ones here in Greater Columbus. And we are going to talk today about problems many of you may have this week. Sorry about that. It's going to be a big sun week. And many of us fall back into this every year. You know you're supposed to guard yourself from sun, but you don't.
Right. So 90-degree weather pretty much all week long. So if you get a sunburn, things that you can do to help soothe it. Remember, Advil, any kind of ibuprofen type drug, it's anti-inflammatory and it'll really calm down the skin.
Can you give that to kids as well?
I check with your pediatrician.
Okay.
Really, we've got to be careful when we're dealing with the little ones.
Right.
That's a great question. Vinegar baths. Put a cup of vinegar into a tepid bathtub, and that'll actually soothe. It's a medical term called a Dombrose soak, and it actually soothes the skin if you get a sunburn. Yeah. So 1 cup of vinegar into your bath water. Good old cortisone 10, any kind of over-the-counter cortisone. It's anti-inflammatory, and it'll calm down the skin. Remember, hydrate. You're losing water. If you're inflamed, your water is actually going into your skin. It's not in your blood vessels. You need to get it back into the bloodstream, so you need to hydrate.
So not pina coladas.
No, not that one.
No alcohol.
Doggone it. Okay. And then what's our next? This is how we take the sting, the pain away.
Right. So how to treat it, and then of course.
Well, let me ask you real quick though. What about those bumps that people get, like sun poisoning stuff?
So sun poisoning, that's really just a really severe sunburn. So if you're getting nausea, fevers, chills, if you're just feeling really ill, then you do have true sun poisoning. The treatment is the same, except you should go to the emergency room if you have certain signs. So if you're getting confusion, if you have a large area of blistering, or if you're having facial swelling, then you need to go to the emergency room, because you probably need to be hydrated with, IV fluids if you have a true severe sun poisoning.
Well, some people will get like an immediate bumpy allergic rash.
Right.
Oh, okay, that's a great question. Okay, so some patients go out in the sun and they react to the sun, the ultraviolet. You can get hives. You can get something called polymorphous light eruption. Lupus can do this. The legend of the werewolf is actually based on a disease called porphyria, where those patients go in the sun, they blister up, and their bodies create extra hair to protect them.
Really?
So
that's interesting.
It is. It's fascinating. So watch out.
So werewolves are actually just
werewolves are just sunburn.
Sun avoidance.
Right, sun poison. Yeah.
Huh.
It's so true. So look at the skin. It can be a sign of something internal. So if you persistently get these interesting rashes, you should actually see your doctor, because it may be something else.
An allergic reaction to the suntan lotions then, or?
Oh, that's possible too.
Okay.
Yeah.
Okay.
So to prevent an allergy to sunscreen, look for ones that have zinc or titanium. If you go with the metal-based sunscreens, you'll almost never see an allergy.
Oh, good to know.
Yeah.
All right,
nice.
so we've done that. Now we're over here.
What is
dealing with our sun?
So the key is prevention.
Okay.
Really stay out of the sun as much as you can.
Sure.
And if you have to be in it, SPF 30 or higher, you want to reapply every 2 hours if you're dry, every 45 minutes if you're wet.
Oh, wow.
And nowadays you can actually get something called SunGuard. SunGuard is something that you put into your wash. You still have to add detergent, but you add this additive to your detergent. It puts an SPF of 30 into your wash and wear clothes, and it lasts for about 20 cycles. So it's
it's safe for your
and
clothing?
it's on your
safe for clothing.
Wow.
Yeah. You can get it online. I haven't seen it in the stores, but I bought it online. It's $1.99 a box. So to get 20 washes for the kids' clothes, I think it's a great deal.
Oh, absolutely.
And you were talking about reapplying sunscreen. Now, if you're out in the sun for a long time, like for instance, people who work outdoors and they're sweating a lot, you would recommend, I assume, reapplying it several times over closer periods of time than 2 hours, right?
Exactly. Every 45 minutes if you're sweating a lot. Think of, when you go to the pool, they blow the whistle every hour, and it forces you out of that water once an hour to reapply sunscreen. So those people that work outdoors, that's what you need.
All right. And lastly, there are some people out there, me included, who spent way too much time in the sun when I was a kid, and now I have some sunspots that have shown up.
Well, it's so true. We all get sunspots, and Coco Chanel is who glamorized the tan. So we've all been doing this for a long time. But you can fade out your sunspots with Hydroquinone over-the-counter bleach creams. Ambi, Porcelana, the one that I brought in today is one by Palmer's. Basically, you spot treat. You need to put it on each little dark spot, and you do it twice a day for 3 months. And I tell my patients, do it 3 months on, then take 3 months off. You don't want to overdo a bleach cream, or you can actually darken the skin, something called ochronosis.
Oh my golly, there's too many things to remember. But this is something that you said over the counter you find stuff like that?
Yeah, so that you can get it. Any pharmacy will have it. And remember, they're sunspots. They're not liver spots. So many people talk about the liver spots.
You get confused by that, yeah.
It's so true. And it has nothing to do with the liver. It's all sun.
And if you need something a little more powerful, it's the Retin-A.
Right. See your doctor for that. Or over-the-counter retinol type products would be helpful too. It's a low-grade medical peel. And by peeling off that top layer, sometimes it will lighten it a little bit. Or you can see your doctor and get freezing stun or laser. Freezing might scar, laser's a little less scarring, but all of those options are available here in Columbus.
At the end of the day, stay out of the sun.
Stay out of the sun. Or limit your exposure, because we all want a little bit of vitamin D.
There you go. All right. Thank you so much. Some great options there.